This is an overuse injury and cannot get better on its own. Two of the most common overuse injuries in youth baseball are Little League shoulder and Little League elbow. Statistics indicate that Little League elbow and shoulder injuries are common and increasing in youth baseball players. Unlike adults, children and teens have open growth plates that are vulnerable to stress. It is concerning to me that kids are now playing year-round on multiple teams. Without proper limits and conditioning, the shoulder and elbow absorb forces they are not yet developed to handle. Early diagnosis is key. Today, we'll be discussing what Little League shoulder and elbow are. For many young athletes, baseball is more than just a sport. It's a passion, a way of life. But the repetitive motions of throwing, especially for pitchers, can put extra stress on growing bones and joints. Two of the most common overuse injuries in youth baseball are Little League shoulder and Little League elbow. Both conditions affect the growth plates, areas of developing cartilage near the ends of bones that are actually weaker than ligaments or tendons. When overworked, these growth plates can become irritated, inflamed, or even damaged. The result of this overuse is pain, reduced performance, and the risk of long-term problems if ignored. With early recognition and proper care, however, most young athletes can recover fully and safely return to the game they love. Statistics indicate that Little League elbow and shoulder injuries are common and increasing in youth baseball players, with some studies showing 20 to 40% of players aged 9 to 12 reporting elbow pain and approximately 30% experiencing shoulder pain over a season. So the symptoms of Little League shoulder typically cause the following: pain in the upper arm or shoulder during or after throwing, tenderness near the top of the arm bone, which is called the humerus, decreased throwing velocity or accuracy, and stiffness or weakness in the shoulder. Little League elbow presents with pain on the inside of the elbow during or after throwing, swelling or tenderness along the inner elbow, decreased ability to throw effectively, and in severe cases, difficulty even straightening the arm. In both conditions, pain usually starts gradually and worsens with continued play. Some players may complain that their arm just feels tired, while others notice that even routine throws become uncomfortable. The main culprit is overuse from repetitive throwing, especially pitching. Unlike adults, children and teens have open growth plates that are vulnerable to stress. Throwing too many pitches, playing year-round without rest, or specializing in baseball too early can overload these structures. Risk factors include pitching too many innings or games, throwing breaking balls, curveballs, sliders before skeletal maturity, lack of rest periods between seasons, poor throwing mechanics, and playing on multiple teams without adequate recovery. Without proper limits and conditioning, the shoulder and elbow absorb forces they are not yet developed to handle, leading to breakdown and injury. So we usually diagnose Little League shoulder or elbow through history and physical examination. So we ask about throwing habits, pitch counts, and symptoms, checking for tenderness, swelling, or limited motion in the shoulder and elbow, and then X-ray to evaluate the growth plate for widening irritation or injury. MRI, if needed, is used to rule out more severe conditions such as ligament tears or cartilage damage. Or honestly, if I can't see on X-ray because it's too subtle. Early diagnosis is key. Continuing to throw through the pain can cause worsening damage and extended recovery time. Treatment options include the following. Most cases improve with conservative, non-surgical care. Rest is the most important step. Athletes usually need to stop throwing for several weeks to allow the growth plate to heal. Ice and anti-inflammatory medications to reduce pain and swelling. Physical therapy, focusing on improving shoulder and elbow strength, flexibility, and throwing mechanics. This helps protect the joint and reduce risk of reoccurrence. Once pain-free and cleared by a doctor, players progress through a structured plan to safely resume pitching and fielding. Surgery is rarely needed, except in severe cases of growth plate damage or when other injuries, such as ligament tears, are present. Preventing Little League shoulder and elbow is just as important as treating them. Coaches, parents, and athletes should follow these guidelines. Please adhere to pitch count and rest rules set by Little League and sports organizations. Try and avoid year-round pitching. Take at least 2 to 3 months off per year from overhead throwing. Delay throwing breaking pitches until after skeletal maturity. Encourage proper mechanics and regular strength training for the shoulder, core, and legs. Play multiple sports to reduce repetitive stress and support balanced development. Parents should seek medical evaluation if a young athlete has shoulder or elbow pain that persists beyond a few days of rest. When they experience pain specifically while throwing and showing decreased performance or struggles to complete the usual movements. Also, when they develop swelling, stiffness, or an inability to straighten the arm, it's time to see a physician. Early intervention helps protect the growth plate, speed recovery, and keep kids safe in the sport that they love. With rest, rehabilitation, and careful return to play, most athletes recover fully from Little League shoulder and elbow. The key is not ignoring early warning signs. Continuing to throw through pain can lead to chronic problems that may threaten a child's ability to play long term. By balancing play with rest, strengthening the body, and respecting pitch count limits, young players can stay healthy and keep their love of the game alive for years to come. So I'm a mom of 3 kids, and my 2 older boys love baseball. Baseball is so big in our community, and it's not just about playing the game, it's about the social aspect of it and the community aspect of it. And I see so often in my office patients coming in with their parents that have Little Leaguers shoulder and elbow, not just in the springtime when it's Little League season, but year-round, because more and more kids are playing travel ball, and not just one team of travel ball, multiple teams of travel ball. And I think it's great that these kids have a love for the game and are really working on their skill in sport. But it is concerning to me that kids are now playing year-round on multiple teams. And when you play on multiple teams, we're not keeping pitch counts between all the different teams. So it's really the responsibility of the athlete and the parent, and even letting your coach know that, hey, I played a tournament just a day or 2 ago and I pitched this many pitches. So it is going to become the responsibility of all those involved. It's not the same as just playing on one Little League team in the springtime, where there is a lot more attention to those pitch counts. And when I see these athletes and parents come into my office, they're often looking for a quick fix. They say little Johnny is just, peaking at the time where they are pitching a lot and doing really well, and they have a tournament coming up or a semifinal coming up. And what do? We really still need him to play. And unfortunately, they don't like the answer. The answer is you have to rest. This is an overuse injury and cannot get better on its own, and in fact could cause a lot of damage as your kid gets older. And I think we really, as parents and coaches and the adults in the room, really need to take that responsibility of teaching our children that this is part of life and that we have to sometimes take breaks at the things that we really love or that we're improving upon, or that, maybe your starting lineup, and after you come back, it's going to take time to get back there. But it's really important for kids to learn that in sports, almost as important as the actual act of playing the sport. So for my children, me and my husband, who is also an orthopedic surgeon, we really pay attention to how often they're practicing, how often they're pitching, catching, fielding. And we also really talk to them a lot about prevention. We have those bands that are hooked up to our sliding glass door, and we tell them each time you come in and out, because you're going to go and hit off the tee, you do your stretches, you do your T stretches, your A stretches, you strengthen that rotator cuff. So I think it's also very important for patients, those athletes, the parents, the coaches, really to work on conditioning the shoulder and elbow quite a bit during that off season or even as part of the season and that conditioning program. Thank you for tuning in to The Resilience Factor. If you're ready to build a stronger, longer lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Pamela Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.